Hi, Dr. Peter Petropoulos from Potomac Medical Aesthetics. I'm going to talk about Coolsculpting today. But before I talk about Coolsculpting, I also want to talk to you about all the other services that we provide in our practice. We do most of the popular non-surgical procedures, including Botox and Dysport for wrinkles that are in the face. We do a lot of injectable fillers, which are for deep wrinkles in the face, laser and BBL services, a lot of platelet-rich plasma services, medical grade facials and dermaplaning, but Coolsculpting is our most popular procedure. It is the only procedure that I can do that has permanent results. So Coolsculpting is extraordinarily popular because it's been around since 2009. That's when it was FDA approved. Coolsculpting was started in the early 2000s, but it was FDA approved in 2009. So we know how hard it is to get rid of that stubborn and fat. We know that you've tried everything, just like most of us, to get rid of very difficult areas on the body. Diet, exercise, and that's what Coolsculpting is really designed for, is to try to get rid of those areas that just won't go away. Stubborn, hard to treat fat. So areas that diet and exercise haven't taken care of. So how Coolsculpting works is really pretty neat. It takes advantage of the properties of the fat cell, which are different than other cells in other parts of the body. And so the fat cell is kind of like a little balloon. And what it does is it stores energy. It sits right underneath the skin. And so any procedure that we do regarding fat reduction, whether it be liposuction or Coolsculpting or any of the other non-surgical procedures, really are targeted on getting rid of fat cells. Coolsculpting is the #1 non-surgical procedure in the United States and in the world, but it takes advantage of a very interesting quality of the fat cell. Fat cells, when exposed to cold, will die, and they do not regenerate. So fat cells that we have in pinchable parts of the body, in the pinchable fat areas, have been there since we were puberty. We make new fat cells up until the time that we go into puberty, but after that, the number of fat cells does not change. And so when we gain weight, the fat cell gets bigger, and if we lose weight, the fat cell gets smaller. So the total number of fat cells in an area of pinchable fat doesn't change after puberty. So if we can kill those fat cells, we can permanently get rid of them, reducing that fat layer, giving a better appearance. And so this is the only procedure that does have has permanent results. So the common areas that Coolsculpting is designed to treat is chin, arms, bra fat, back fat, love handles, abdomen, inner thighs, outer thighs, the knees, but realistically any area that we can pinch and get up into the cup of the applicator can be treated. So the way the machine works is really interesting. We will place this over any part of the body that we're treating, and the way it works is we will put a sticky pad on that area, and we will then apply the suction and then place it over the area that we're treating. The suction then brings up your skin and your fat into the cooling cup, and that cooling cup goes to -11 Celsius, which is about 16 degrees Fahrenheit. And during that treatment time, which on average is about 35 minutes, we're literally freezing the fat cells. And so once we freeze them, on average, we will trigger cell death in about 25% of those fat cells. Now, the cooling cups that we use are what are called the Cool Advantage. This is the newest generation. We have all the newest applicators, and so the results are better, and it's a quicker treatment time. One other advantage of our practice is that we use the Zimmer Z-Wave. The Z-Wave is the massage portion of the treatment. Massaging the the area of fat that's been treated is critical in getting maximum results. So the Z-Wave is not something that every practice uses. We do not charge extra for this, but we find that it gives better results, but it's much more comfortable to the patient. So the treatment itself is very mild. The Coolsculpting procedure feels like somebody's putting ice on your skin, and then it feels like a little stingy, a little prickly, and then it gets numb. And so typically for the last 30 or 25 minutes of the procedure, it just feels a little cold, you feel a little bit of suction, and then you pretty much relax, watch television. If you're here over lunchtime, we will bring lunch to you so that you can eat something. But nevertheless, the Coolsculpting procedure itself is very comfortable, and that's why people get it done very based on the fact that it's super comfortable and it gives the best results on the market as far as non-surgical procedures are concerned. The massage portion can be done one of two ways, either manually, where we pinch the fat to really try to break up more fat cells, or using the Zimmer. We prefer the Zimmer. Not only does it give better results, but it's much more comfortable for the patient. Patients who have had both techniques always will tell you that this is much more comfortable. Not only that, but the swelling and the soreness in the aftermath of the procedure are much reduced as far as manual massage versus the Zimmer. So the Zimmer, the Z-Wave, is the way to go with that. So what do patients feel after the procedure? On the day of treatment, the treatment is very comfortable. Most patients say, this is much better than I ever thought it was going to be. So the normal progression would be to have some numbness on the night of the treatment in the area that we treat, and then the next day most patients will wake up and say, I feel a little bit sore. And it's mostly soreness to the touch. It's not a soreness where you feel like you went to the gym and every muscle is hurting. It typically feels like if you squeeze that fat area, that it feels kind of sore. Most patients take no medication, but some will need to take a little bit of Tylenol or Motrin, but it is not a soreness that anybody has ever described as severe. All of us in the practice have had the procedure, so we know what it feels like, and it's mild soreness at best. That typically will last for about 5 days, maybe up till 7. The swelling after the procedure is very mild, maybe for about a day or two. Numbness in the treatment area typically lasts for about 2 weeks, and then it typically will go away after 4 weeks total. So it's a very comfortable procedure, and adding the Zimmer makes it even more comfortable. So Coolsculpting has very strong results if the patient that is picked is the right candidate. So just like any other medical procedure, the reason the consultation is so important is because we need to make sure that that patient is a good candidate for Coolsculpting. Coolsculpting is really best on patients that have stubborn areas of fat with not a lot of fat tissue. So there are patients that have excessive tissue that may not really be ideal candidates for Coolsculpting. And so there are patients that commonly will refer to plastic surgeons for liposuction just because of the amount of fat tissue, where it would take too many Coolsculpting cycles and it may not be cost effective, or the results that somebody's looking for may not be attainable with just Coolsculpting. If somebody has extremely loose skin in a treatment area, particularly in the abdomen after pregnancy or after significant weight loss, Coolsculpting will certainly work on killing the fat cells, but the loose skin that may be excessive may not be easy to give the aesthetic appearance that patients want. So oftentimes we still have to steer patients out of Coolsculpting and maybe into plastic surgery. So those are typically the limitations associated with Coolsculpting. Patients who should not have Coolsculpting are a very rare subset of patients. The patients that should not have Coolsculpting are those who are pregnant or breastfeeding. We just don't know if it works because you just can't study patients like that to see if it's going to be effective. So we always tell patients to wait until pregnancy, at least 6 months, is over and breastfeeding is stopped. 3 rare conditions associated with Coolsculpting called cryoglobulinemia, paroxysmal hemoglobinuria, cold-induced, and cold-induced anaphylaxis are 3 rare conditions associated with Coolsculpting that would not allow us to do Coolsculpting on that patient. So if you have seen a rheumatologist for any of those conditions, which are extremely rare, we wouldn't be able to do that to you. So people ask us some very common questions about Coolsculpting. Well, will I lose weight with Coolsculpting? Coolsculpting will not cause weight loss on the scale to any significant degree because it will cause some loss of weight, but it's typically under 1 pound for an abdomen, so it's not going to be a sizable change on the scale to say that you're going to lose a lot of weight. So if someone thinks that they're going to lose 10, 15 pounds of Coolsculpting, no, Coolsculpting will not cause you to lose weight. You will have changes in the mirror and changes in the way your clothes fit, and that is what will happen with Coolsculpting even without a sizable weight change. Many patients will say, well, what if I gain weight after my Coolsculpting? Well, if you gain weight, you will certainly gain weight in other parts of the body that were treated, were not treated, but in an area that you were treated with Coolsculpting, you will gain weight because you will still have 75% of healthy fat cells that were not killed after one treatment. And those cells will grow, but you won't grow as much as you used to when you gain weight in an area that's been treated with Coolsculpting. Same as things as liposuction and the other non-surgical techniques. If you lose weight, an area that's treated with Coolsculpting, let's just say theoretically we lose 25% of fat from an inch of fat. Now you'll be down to 3/4, but you still have 75% of the existing fat cells left. So those cells will shrink, so you will have an increased effect. Most of our patients will not come back with any significant weight loss or weight gain because that's the way it is. They come back at the same weight, even though the effects are very noticeable, the weight doesn't change. But in patients who do gain weight after the procedure, typically from dietary increase typically or any change in lifestyle, the Coolsculpting still typically will show effect, but it may not be as significant as if the weight had stayed the same. In patients who have come back with a significant weight loss, we see a compounded effect. People ask us how many times can we do Coolsculpting? Well, we usually will wait for at least 2 to 3 months before we do another round of Coolsculpting, because that's the earliest you would want to do it, typically no earlier than 2 months, because there's still fat that is in the way of doing another successful treatment. But if someone comes back after they've done Coolsculpting, if they had an inch of fat and they went down to 3/4, we will have another 25% reduction of fat with another treatment. And it can be done as many times in order to get the amount of fat loss that the patient desires. Most of our patients will do it one time and they're happy with the results. If they want even more fat reduction, they may do it a second time. So those are the typical questions, and during our consultation, if you have additional questions, we will definitely answer that. So during your consultation, not only will I examine you to make sure that you're a candidate, but I can give you an accurate assessment of how much it will cost, as well as show you before and after pictures to give you a really good idea. Because setting expectations with any non-surgical or any surgical procedures is very important in making sure that it's the right procedure for the patient. We look forward to your consultation, and thank you for watching.